a film on practical wound care for patients suffering from epidermolysis bullosa.
Was schöne Ruhe.
This film is about 11-year-old Lilli, who has had epidermolysis bullosa since birth.
Der Film heißt Lilli, die Pferdeflüsterin.
Epidermolysis bullosa, EB, is a rare skin disorder often characterized by severe blistering of the skin.
Also das sind halt Handschuhe, die ich anziehe, weil nicht weil mir kalt ist, sondern weil ich kann die Züge nicht so gut halten, weil das tut mir weh. Ziehe ich eben die Handschuhe an, damit die ein bisschen schützen.
Currently, there is no causal therapy or even a cure for epidermolysis bullosa. Proper wound care, as well as pain relief and wound prevention, are thus the main treatment for this disease. Using Lilli as an example, we want to show how wound care is applied. Lilli's mother, Steffi, a trained nurse, knows exactly which hand movements must be used in order to provide optimal wound care.
EB does, after all, actually turn family life upside down at first. Daily life has to be completely reorganized.
Also das hier ist der Backen und darüber kriege ich meine Ernährung, Sondenkost, Wasser und so, alles halt, was man zum Leben so braucht.
And we somehow try to integrate changing dressings into the day in such a way that family life can still go on without the disease dominating everything.
Klammer auf.
Proper wound care, as well as pain management and wound prevention, are thus at the forefront of this disease.
Lilli was 9 years old when she got the feeding tube because one day she couldn't swallow any water at all, or even her saliva.
Ich wechsle jetzt das Backenpflaster.
And since she got the tube, her weight and size has increased significantly. She's made amazing progress, and the wounds have, I think, also become a bit better since then. Wound healing is simply much faster when there are enough substances in the body, so to support it, and that the body needs. There are 1,000 different manufacturers. We use this tube feed. And I buy normal protein powder from the drugstore, which is easy to swallow. When the child takes it by mouth, I don't think it matters which protein powder you use. You can stir it into anything, any pudding, yogurt or whatever. Of course, it's always important to disinfect your hands before you do anything at all. So don't be sparing. Correct hand disinfection requires more than just a small squirt, but at least 3 millimeters. Really fill the hand with disinfection and then rub it thoroughly, especially the fingertips and thumbs, which are often forgotten. The spaces between the fingers, that you disinfect everything, and the wrists as well. Then I'll get started. These silicone wound dressings are hardly adhesive at all. There are a few places that bleed easily, so I actually place an additional wound spacer grid underneath. But these are only individual spots. Every blister that we find always has to be opened immediately. Because with EB, they quickly flatten and then just keep spreading out from the edges, and from an original small blister like this one here, which is currently, I don't know, so big, if I don't prick it now and just wait until tomorrow, then I can be sure that this whole area will be filled if it doesn't burst on its own. At least once a day, you really have to be sure to empty any blisters that have formed. Yes, what you always need are obviously cannulas to open the blisters sterilely. And the best way to puncture the blisters is not just to poke a hole in them, since the edges of the hole then swell up due to the fluid, and this swelling closes them again. At least that's my theory, or my experience. Instead, you always try to tear a little slit in them without lifting off the skin even more. Because firstly, that hurts, and secondly, more skin is lost. Opening the blisters doesn't really hurt, does it, Lilli? So here I'm already in, and then I pull it along here a little bit, like this. So there's a big slit, and then it empties. I use relatively simple compresses to empty the blisters, which are not sterilely wrapped. That would be completely different in the clinic, but for home use, the non-sterile compresses are quite sufficient. There's another blister here on her back. It doesn't matter which blister comes from where or what. And when the blister is flat, I disinfect it. We use mucous membrane disinfectant because it doesn't burn. I really ensure that the compresses are really well moistened. Well, hygienic work and disinfection are naturally very important, since the children have extensive wounds and they already have a good immune system. The body is actually already well trained to defend itself. But I think that if, by simply keeping an overall germ load as low as possible, the body may not quite need so much effort to avoid infection.
The first symptoms, such as blisters, wounds, or open areas of the skin, generally appear shortly after birth. Subsequently, the clinical manifestation of the disease varies, ranging from localized blistering, especially on the hands and feet, to generalized blistering of the skin and mucous membranes, sometimes resulting in damage to internal organs. In certain severe cases, permanent injury to the skin leads to pronounced scarring and limitations to the function of joints on the hands and feet. In some cases, or in certain forms, the disease may be life-threatening at an early stage due to the onset of skin tumors or severe involvement of other organs, for example, the respiratory tract.
EB skin primarily needs fat, and not quite so much moisture, but there's fat. We also like to use this unguentum leniens with coriander oil. We mix that together from the pharmacy, which is what dermatologists in Freiburg like to use. But the most important thing, in my opinion, is actually fat. It's also important that the crusts loosen well at the edges of the wounds. I'm now using a special open-pore foam from Möllnicke called Mepilex Transfer, which is a material that is above all very flexible. What's special about Mepilex Transfer, and I don't know this from any other foam, is that up here it is permeable. There is no film that would somehow make the whole thing more or less watertight, but it is completely permeable. And the exudate simply runs through this foam into a secondary dressing. The advantage of this is the lack of film makes the foam incredibly flexible. It can be pulled and stretched in all directions. And then this is just molded to fit this area. So, good. And then I would wrap the foot again. It's also very important to me that the bandages I use stretch well and are flexible, so they adapt perfectly to every movement.
Die passen sich ganz optimal jeder Bewegung eigentlich an. Man versucht da möglichst
and try to wrap it as smoothly and wrinkle-free as possible, because every wrinkle can press again, as wrinkle-free as possible. So then it holds and she can pull a normal sock over it. Of course, you have to be able to stretch it really well, so always use really stretchy materials, as otherwise you move all the bandages, and then just cover it piece by piece, and it will be well fixed.
Determining the specific type of epidermolysis bullosa is very important when applying care. With newborns and babies, it is essential that parents and caregivers are initially well trained so as to change dressings quickly and safely.
Und obwohl ich das so vorsichtig abgelöst habe,
and even though I removed it so carefully, it is bleeding again. And every time it bleeds, it's just, well, basically bad, you could say, because, of course, some cells, skin cells that would have closed the wound, are always pulled off or torn open, and then it starts all over again.
Aufgerissen und dann geht's halt von vorne los. Willst du es selber machen?
Would you like to do it yourself?
Also meine Erfahrung ist,
So my experience is that the pain, the fear of pain before the bandages come off, that fear just potentiates the pain.
dass diese Angst, den Schmerz einfach noch potenziell zu machen, sie bestimmt.
To make clear that she has some control over her body in that sense, that means that when she says, "Stop, Mama," that means stop for now.
Stopp.
Since open wounds are painful and also a gateway for germs that can cause inflammation, it is crucial to learn good care of these skin areas when dealing with epidermolysis bullosa.
Wunden, die sehr sensibel sind, die immer wieder bluten.
On those wounds that are very, very sensitive, that bleed over and over again and are at the moment usually also very painful, I prefer to actually use another wound spacer grid before applying the foam dressing.
Distanzgitter auf.
I bandage the upper part of the knee a little differently so as to guarantee as much mobility as possible. That's why I use several small strips on top of one another. In places that secrete heavily and need to be well padded, such as the knees, I add a super absorbent suction bandage on top. And to fix that, I also use stockings which can be washed again and again. I much prefer them to bandages, which always tend to slip. It's good when she does it herself, as anything she does by herself is less painful than if someone else does it, which is beyond her control. In principle, we always have to leave the fingers open, even if there are injuries. Wrapping her fingers doesn't make much sense, in my opinion, because she has to be able to do as much as possible with her hands, at least with the dystrophic form, to simply counteract this scar development, so that her fingers retain the greatest possible mobility. But she can still open and use her fingers relatively well. And everything that she does with her hands, with her fingers, is like stretching the scars. And so it's like physical therapy for her.
Dehnung der Narben und damit wie Krankengymnastik für sie. Und je besser man
And the better you can somehow prevent this from growing like this, then I think the better she can maintain her independence.
besser kann sie ihre Selbstständigkeit erhalten. Da kommt ganz, ganz viel Creme.
A lot of cream goes on the elbow to give it a lot of mobility. A lot so that it glides well.
Dass das da ganz gut gleitet. Das Wickeln der Hände.
Wrapping the hands, I think, is very important in order to delay the fingers growing together.
Das Zusammenwachsen der Finger
Or perhaps even prevent it altogether.
vielleicht sogar komplett zu verhindern. Ich beginne hier am Handgelenk.
I start here at the wrist. Then I go from below, once through here, between the little finger and the ring finger, under light pressure. You need a little pressure, but you have to get a feel for how much to use so that you don't injure anything.
Und dann geht's immer in einer
And then it's always in a figure of 8 tour, around the wrist and down again, and next between the index and the middle finger.
und Mittelfinger durch. Wieder
Again, light pull.
und wieder
And again, with a figure of 8 around the wrist, and then, last but not least,
als
no, as the penultimate, then here between the two fingers, and again,
wieder
around the wrist.
Handgelenk. Und der
And the
Daumen
thumb is the most important finger of all anyway,
weil man den
because you
immer als
always need it as a counterpart when gripping.
So, auf den muss man ganz besonders
You have to make sure that it really does go in twice.
sogar zweimal rein.
Ich tue es nie mit den Fingern machen, sondern ich tue die Belastung hauptsächlich hier haben.
Und auch für mich als
And for me too, as a mother, it's just incredibly stressful when I'm constantly busy protecting the child and making sure that nothing happens.
und aufzupassen, dass da auch ja nichts passiert. Das ist auch
I don't think that's good for the parents either.
Sie soll
She should try to live her life halfway normally.
In many other European countries, or the world, it is far from a matter of course that the costs of bandaging material, ointments, creams, and medications are covered by health insurance. Unfortunately, this often requires compromises, because the most suitable material cannot always be financed.
also zum Beispiel im Gesicht.
So, for example, her face. She usually never has any dressings on her face.
Auch am Rücken.
Also on the back, I let it rather crust over naturally, even if it looks pretty awful right now. At the moment, her back is not too bad, but we also already had that. Everything was open also here, which is also so inflamed. But even that, as long as it does not secrete too much extremely, I prefer to leave open so that it crusts over. That creates the fewest problems.
The film is intended to help provide such essential bandaging material to affected families and their children, regardless of the color of their skin or their origin.
When I see such pictures, I realize just how incredibly important it is that one helps these children, because I already know how bad the illness is. Even if everything goes well, and I can't and don't even want to imagine the ordeal this child has to endure every day with his wounds and his bandages. It's inconceivable, and help is urgently needed. So anyone who can do anything, please do something, because that is no kind of life at all.
Das ist kein Leben so.
Therefore, we ask you to donate and help the affected children and their families to alleviate this incurable disease.